Hi, I'm Dr. Aaron Greenstein. I'm a geriatric psychiatrist and dementia specialist. In this video, we will review a BrainCheck Assess report where the patient timed out on Trails B but performed normally on all other tests. Trails B requires the patient to alternate between numbers and letters in sequential order. For example, 1A, 2B, 3C. For each number and letter, patients have 30 seconds to make the next correct selection. Trails B is a particularly difficult test as it assesses the integration of multiple cognitive domains, including cognitive flexibility or set shifting, executive function, processing speed, working memory, visuospatial ability, and attention. A patient's performance on Trails B can have three different outcomes. The patient completes Trails B and is given a score. The patient partially completes Trails B and times out. The patient is unable to complete Trails B at all. If your patient completes Trails B, you will see a score. If your patient does not complete Trails B, there is no score, and the combined score is therefore not impacted. However, you will see the number of correct answers your patient selected. Let's talk about if your patient partially completed Trails B. If the patient was able to complete some, but not all of the tasks, this indicates that they have deficits, but not full impairment in the domains of cognition tested by Trails B. If no correct answers were selected, the patient was likely overwhelmed by the task's complexity. This is concerning for global dysfunction in the cognitive domains tested by Trails B, which may translate into difficulty managing complex real-world tasks. If the patient either times out or has poor performance on Trails B, we recommend assessing for the functional impact of these cognitive deficits. This can be done by administering IADL and ADL assessments, which are in the BrainCheck platform. You should also consider screening for mood, anxiety, or attention issues that could have interfered. Standardized assessments for all of these are on the BrainCheck platform. Interpretation of a Trails B timeout requires strong clinical judgment and a more nuanced approach. We encourage clinicians to go beyond the score and look at the patient holistically, including medical comorbidity, and consider a functional assessment, particularly of instrumental activities of daily living, to assess for the impact of cognitive changes on day-to-day life.